You're watching WGAL 8. Now, coverage you can count on continues from the Susquehanna Valley's most watched news team. This is News 8 at 5 in HD.
Women and doctors are getting a new ally to cut down on the number of deaths from breast cancer, and it begins with early detection.
Governor Tom Corbett was flanked by pink inside the state capitol this morning when he signed into law today a bill that requires mammograms to include breast density information. Cindy Spinello's doctors missed stage 4 breast cancer in her first mammogram due to her breast density.
Early detection saves lives, and there is nothing more important or valuable than the gift of life.
8 on Your Side medical reporter Suzanne H joins us now with more on why breast density is so important in the early detection of cancer.
Dr. Nitin Tanna is head of breast imaging at Lancaster General Health and helped with the language of this law. Dr. Tanna, thanks for joining us. Tell me, what do we mean by breast density in women?
Breast density refers to the amount of dense tissue, which is the fibrous and the glandular tissue, as opposed to the fatty tissue, which appears completely black on a mammogram.
And why can that put a woman at higher risk for breast cancer?
More dense tissue means about a 2 to 6 times higher risk because there's more areas where cancer can develop.
And you say there are 4 levels of breast density. We're going to take a look now at some images, some mammograms from the Lancaster General Health. On the left, it says 10%. This is one that is not a dense breast?
This is what we categorize as fatty replaced breast parenchyma. 10% of U.S. women would have breast tissue that looks like this on a mammogram.
All right, and the next one?
The next one is what we classify as scattered fibroglandular elements.
And the one second to the right?
The second to the right is what we call heterogeneously dense, and then the one on the right side is extremely dense.
And I know you have said that it's like looking for white bunnies in a pile of white snow. Tough to see, but this third one, you did spot a cancer in that dense breast.
Absolutely, and that's why I included this in this file of images, because the area that is circled with a yellow circle is actually a small cancer that we've picked up at our facility despite the background parenchymal image.
And just lastly, are you glad women will have to be told now if they have dense breasts?
I think women should be knowing this. We've always classified breast density as part of the interpretation of the mammogram. It's just that this information was never fully communicated to the patient.
All right, very good. Thanks so much for joining us. We appreciate it.
Thank you,
Back to
Susan.
you.
Thank you, Susan.